64-year patient presented with generalized abdominal pain with poor bowel opening for 1 week. On examination shows 2 hernial orifices at the paraumbilical and at the right iliac fossa regions. X-ray abdomen done. It shows dilated small bowel loops without air fluid levels or intraperitoneal air lucencies. Suggestive of possible uncomplicated small bowel obstruction. No perforation of the bowel loops. Urgent ultrasound abdomen done. It shows dilated small bowel loops with 2 hernias at the paraumbilical and at antero-inferior lateral ventral wall of the right iliac fossa, likely paraumbilical and Spigelian hernia. Gastrointestinal contrast study with flow-through done. It shows mild distension of the proximal bowel loops and delayed contrast passage into distal small bowel loops. Large bowel loops are filled with contrast in delayed images. No contrast extravasation or leakage. Suggestive of partial obstruction due to anterior abdominal wall hernias. Contrast-enhanced CT of the abdomen and pelvis done for further evaluation. It shows nasogastric tube in situ. 2 hernial orifices are noted in the anterior abdominal wall, causing prominent proximal small bowel loop segments, maximum diameter of the small bowel loops measuring 2.9 centimeters in size. Distal large bowel loops are patent and collapse. Details of 2 hernias. Paraumbilical hernia. Large hernia noted at the paraumbilical region with herniating long segment small bowel loops within the hernial sac. Right Spigelian hernia. Hernia orifice noted along the semilunar line of the right anterior inferior abdominal wall, resulting herniation of short segment of the small bowel loops in between the muscles of the right anterior abdominal wall at the right iliac fossa region, associated with small bowel wall edema. Small bowel loops show mild bowel wall edema with normal contrast enhancement. Mild amount pelvic free fluid is seen. No large bowel loops dilatations. No evidence of free intraperitoneal gas. No pneumatosis intestinalis, no portal venous gas, no SMV thrombosis. Liver is normal in size and density. No focal lesions or no intrahepatic biliary duct dilatations. Prominent CBD is seen, 7.5 mm in diameter, likely due to age-related. Gallbladder is normal, no calculi within it. Spleen and pancreas are also normal. Few simple cortical cysts are noted in the both kidneys. A tiny calcific focus is seen in the midcalyceal group of the left kidney. No hydronephrosis or no hydroata. No suprarenal masses. Retroperitoneum is normal. No evidence of para-aortic lymphadenopathy. IVC and the abdominal aorta are normal in caliber. Bladder is partially filled and catheter bulb in situ. Degenerative bone changes seen in the available images. Visualized lung fields are clear. No lung nodules or masses. No pleural effusions. Comment. 2 anterior abdominal wall hernias at the paraumbilicus and right inferolateral ventral wall, likely paraumbilical and Spigelian hernia, causing partial small bowel obstruction. Mild bowel wall edema involving small bowel wall loops. Mild amount pelvic free fluid. No evidence of free intraperitoneal gas, no pneumatosis intestinalis, no portal venous gas, no SMV thrombosis. Few simple cortical cysts in the both kidneys. Bosniak grade 1.